Hello, everyone, and thank you for joining us today. I'm Susan Blumenfeld, Director of Training and TA for the National Center on Domestic Violence, Trauma, and Mental Health. We're really delighted to have you join us for this webinar series on trauma, opioids, and domestic violence. This series is being hosted by the National Center and is co-sponsored by CTIP, the Campaign for Trauma-Informed Policy and Practice, and ACES Connection. For those of you who may not know what ACES stands for, it's Adverse Childhood Experiences Study. Okay, so before we get started, I'd like to go over some of the technical details of our WebEx software that we'll be using for today's webinar. Many of these details are explained on the Using This Webinar System tab in the center of your screen. You can switch to this screen from the slides by clicking the down arrow next to Using This Webinar. Be aware that your screen might look a little different depending on whether you're using a Mac or a PC. On the right-hand side of the screen, there are multiple boxes. Third from the bottom, depending on your screen, is the chat feature. And you may have to click on the chat cloud icon at the bottom center of your screen to open your chat box. I think this is true for Macs. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with the presenters or myself if you have questions regarding the training content. You may also contact Carla Alegria with our center if you have questions troubleshooting the WebEx software. Okay. To do this, click the down-facing arrow and select the person you would like to contact. You'll see you have a lot of options. But for this session, you'll want to select all participants if you would like to respond to a question from one of the presenters or to contact center staff anytime during the session. You should click on Carla Alegria to privately contact her if you need troubleshooting with the WebEx software. Okay, so let's test this chat feature. Will everyone please go to the chat box on your right, click on all participants, and type in where you're calling from, and then press enter. Hopefully we'll see some responses. There we go. Great. Coming in. Terrific. Oregon. Topeka. California. Excellent. Okay. Thank you very much. While people can get a lot out of the chat feature, there are times when it moves really quickly and can feel distracting. If this is true for you, feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We'll be providing live captioning during this webinar. It's below the chat box. There's a media viewer box, and this will contain the captions. If you don't want to see the captions, click on the down-facing arrow next to the word media viewer, the same way you might if you want to hide the chat box. Time permitting, I'll be moderating the Q&A towards the end via the chat box. And then at the very end of this webinar, you'll be taken to a brief survey. We hope that all of you will take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes the sound does cut out due to internet connection, so feel free to call back in if that's a problem for you. Okay, now that we have all mastered the technology, hopefully, we know there are always glitches, but hopefully this will go well. I want to talk about today's webinar. which is titled Florida's Early Childhood Courts, Transforming Child Welfare. And now I'm going to see if I can master the technology by moving the slide set. Okay, let's see. Hey, I did it, yay. Okay, so this slide just takes you to who's hosting and who our co-sponsors are for this webinar. The webinar will highlight the approach, process, lessons learned, and some really compelling outcomes from Florida's 22 early childhood court teams. And these teams serve families with children age 3 and younger and their caregivers in dependency court. We'll be hearing from our presenters about how Florida's early childhood court teams help young children to have safe, stable placements in as short a time frame as possible while striving to keep families together. This approach is based on the National Safe Babies Court Team model developed by the 0 to 3 organization, and it was designed to break the multi-generational cycle of child maltreatment. And I'm going to go back so you can see where, oh no, I guess this had our sponsors, sorry. Okay, so before I introduce our presenters today, let me tell you a little bit about our center and our co-sponsors. So the Campaign for Trauma-Informed Policy and Practice is a national organization created to address the impact of trauma across the lifespan and to work in partnership with individuals, communities, cities, states, tribes, and federal policymakers to promote trauma-informed resilience and prevention-focused policies and practices, and to create a more just, equitable, and trauma-informed society. ACES Connection is a wonderful social network, which I am a part of, for the Adverse Childhood Experiences movement. ACES Connection, and again, that stands for Adverse Childhood Experiences Study, connects those who are implementing trauma-informed and resilience-building practices based on the ACES science. The network's 35,000 plus membership is ever growing. Members are able to share their best practices while inspiring each other to grow the ACES movement. And you can stay current with this network by clicking on acesconnection.com. And now I'm going to take you to talking a little bit about your host today, our National Center. So we are a U.S. Department of Health and Human Services Administration on Children and Families, Family Violence Prevention and Services Program funded, whoa, what a mouthful, Special Issue Resource Center. And we work on the intersection of domestic violence, trauma, and behavioral health, and we've been funded since 2005. We're engaged in training and TA, policy, and advocacy efforts to improve the services and systems that support the safety and well-being of domestic violence survivors and their children. And our center has really pioneered promoting an approach that we call accessible, culturally responsive, trauma-informed. So ACRTI for both the domestic violence field and for the mental health, substance use, child welfare, and legal systems, the systems that survivors and their families turn to. And we've done some work and have resources on our website that may be particularly germane to this webinar on substance use coercion in the lives of DV survivors. So I encourage everybody to check out our website if you haven't already. Okay, and this just tells you who our sponsors are. And at this point, I'm going to tell you a little bit about today's speakers. I'm going to go back to the title slide here just for a moment. Okay. So Dr. Mimi Graham is the director of the Florida State University Center for Prevention and Early Intervention Policy. She served in this role since 1993. She oversees a multidisciplinary team with a national reputation as a center of excellence in trauma, maternal health, state policy on best practices for court-involved and human-trafficked pregnant and parenting teens. Dr. Graham has many publications and accomplishments, and amongst them are 10 components of quality infant and toddler child care, as well as the Florida State University's Partners for a Healthy Baby Home Visiting curricular series. Dr. Graham also co-founded the Florida Association for Infant Mental Health in 2002 and built a professional development network in Florida and integrated infant mental health across systems. As a member of the Florida Supreme Court Committee on Children, she created partnerships to create Florida's Early Childhood Court Initiative, an innovative approach to break the multi-generational cycle of abuse. She also spearheaded a think tank of state and community leaders working to create a trauma-informed state, resulting in a compilation of a showcase of Florida's cutting-edge trauma initiatives. She's a fellow of the 0 to 3 National Center for Infants, Toddlers, and Families and has received numerous awards for her work. Our second presenter is Judge Lynn Tepper, retired at the end of this past year on December 31, 2018, after serving as a circuit court judge in Florida's sixth judicial circuit for 3 decades, preceded by 4 years as a county judge in Pasco County. Judge Tepper's last judicial assignment was to handle all East Pasco cases involving child abuse and neglect, juvenile dependency, all family-related cases, including domestic violence. For 6 years, from 2012 to 2018, her court was one of 6 sites in the U.S. selected to implement something called a Project One, one standing for one judge, one family, no wrong door, equal and coordinated access to justice. And this was a National Council of Juvenile and Family Court Judges model program. Her early childhood court, over which she still presides as a senior judge, was one of the demonstration sites with 0 to 3. Judge Tepper was appointed in 2018 to the Chief Justice's National Judicial Opioid Task Force. Judge Tepper has served in virtually every Florida Bar Supreme Court committee involved with children, families, and domestic violence, including the original Florida Gender Bias Study Commission. She teaches and speaks nationally and statewide on bonding and attachment of children, trauma-informed courts, and ACEs and human trafficking. Judge Tepper has received numerous awards in the field of literacy, criminal law, and social work, as well as recognitions from the Florida Supreme Court. So as you can see, we have 2 esteemed presenters that I'm very excited to get to in a moment. Just to remind you, if you're experiencing any technical difficulties during the webinar, please contact Carla or call WebEx Tech Support, and Carla will put that number in the chat box for you. And now I will advance back to where I was. It is my deep pleasure to turn the mic over to Dr. Mimi Graham.
Great. Thank you so much, Susan, and we're delighted to be with you today, and we'll just get started. So I'm sure you all know about how early adversity really is the pipeline to so many of our societal problems, and we wish more policymakers would understand that connection. We love the Robert Wood Foundation grid that really shows how the adverse childhood experiences, that the 10 original ones, as well as many folks have found also community ACEs and poverty and additional adversity that is impacting children's mental health later on.
And I just want, this is Judge Tepper, I just wanted to urge you to go to that site, and you might find very helpful materials to share if you're a clinician, a therapist, a doctor, with your patients so they can understand what happened to them. They're very simple ways of explaining it. Go ahead, Mimi.
We like this slide because it just kind of has it all together in one slide, and that is the whole multi-generational cycle. And courts are trauma centers. Everybody coming into court has some kind of trauma they're bringing, and so often the cycle is that the children start in dependency. Something like 90% of kids in delinquency have a past history in dependency. And then often these delinquents are also part of domestic violence or drug court, and then often end up in criminal court. And so this adversity is transmitted across generations and can manifest in any of the characteristics on the right-hand side. I know Judge Tepper has so many stories of grandmothers who were in her court, and now the grandchildren are in her court. So she's certainly seen this over and over again.
And for those that don't use the term dependency in their state, that would be child abuse and neglect cases that come into court. And regardless of the division in Florida, our Florida courts presume somebody enters the courts with a trauma history. And that's why we have been fighting to make sure that everybody that touches the life of a child in the court system and who we refer people to is trauma informed and addresses the underlying adverse childhood experiences.
Our state has really made an investment, our Office of Court Improvement, and every state has one, and they have training dollars. Judge Tepper and I have been doing training for maybe close to a decade, and I bring the science, she brings the judiciary experience, and together we've trained hundreds of judges, and they're fast studies, they get it, and it's like, okay, so how can we do this differently? So it really is a light bulb that goes off when we talk about trauma in the courts.
And before you change the slide, on the right side, if you look at some of the in-depth writings that Dr. Folletti, Dr. Anda, and others have done, they have different grids to show what their original study highlighted the likelihood you will have any of these things happen in your adult life, all the way from anxiety to life dissatisfaction. So again, you should check those resources to see how likely, but you can see it cuts across every bit of adult life. Go ahead, Mimi. This is, if you haven't been to, you'll see the link down at the bottom, AIR.org. The reality that trauma is a public health issue, although unfortunately the medical community has been very slow to pick up on it. The courts are beginning to pick up on it. First article didn't even appear until 2004 in Ohio. But it is so prevalent. And if we had any doubts, some stats that are included, if you go to that link, you will see yet another grid showing that 98% of female offenders often have interpersonal trauma and domestic violence in their history. 96% of adolescents that are in psychiatric inpatient have been exposed to multiple traumas. 93% of hopeless moms have a lifetime of interpersonal violence and trauma. 90% of juvenile justice involved youth have multiple trauma issues from an early age. And although I believe this is underreported because they are slow in the substance abuse field to pick up on doing ACE surveys, 75% of adults in substance abuse treatment programs have it. And again, very low estimate, and that is from about 10 years ago, 70% of foster children have multiple trauma. As you can see, if we want to solve the problems in our society, we need to address the underlying trauma and ideally prevent it, and that's what early childhood courts are. And Mimi, the next slide makes it clear why it's such a problem.
because babies are really the largest group coming into child welfare, kids 1 and under. Kids under 5 make up more than 50% of the kids coming into child welfare, into out-of-home care. And the earlier kids come in, generally, the longer they stay in the system and the more detrimental. So why early childhood court? Particularly with the opioid epidemic, babies, neonatal exposed children are the largest group coming into out-of-home care. And we also know it's the most opportune time for brain development, that 90% of the brain is developed by age 5. And so it's such an opportunity to get these kids on the right trajectory. We know that, depending on where you are, but nationally 70% of kids are removed due to a drug issue, and 40% of those are newborns. In Florida, we had 4,000 babies born substance exposed. As of January of 2019, we had over 12,000 children under the age of 3 in our out-of-home care. So it is our largest age group. We also know, as you all know, that early adversity predicts substance abuse, whether it's alcoholism or other kinds of drug use. That the higher the ACE score, the more likely that you will have a substance abuse issue. So why does trauma matter? Well, because trauma is so often the underlying issue in why there is substance abuse. And we're going to talk about that later. And addressing trauma is really key to protecting kids from entering the system later as an adult. And so we love the new Family First legislation that is really moving towards a more preventative approach of providing services in the home before kids are removed and before so much of the detrimental effects occur.
And the irony is, in one of Dr. Folletti and Dr. Anda, along with 6 other doctors, one of the first articles that were written after they talk about all of the impacts on adult health and why adversity leads to difficulty, they talk about what really should be the primary, and that is to be preventative. And the irony is that he basically outlined what has become safe baby courts or early childhood courts. He in essence had a dream that we should be focused on promising programs that focus on children birth to 3 in order to prevent ACEs, that we should be considering back then when it was new healthy steps, having home visitation programs for new parents, to have specialists, this sounds like our infant mental health specialists in development and psychosocial dimensions of both the child, that understood the childhood and parenthood developmental and psychosocial dimensions. And that's, I believe, all the more reason that this is effective, all the more reason that Families First is wise to be focused on preventative. Because, of course, go Mimi?
No, I'm sorry. Go ahead.
No, go. You can go ahead, and then the next slide.
So the term therapeutic jurisprudence is often used, and that is really bringing a therapeutic approach into the court, not only looking at the case that brings the family into the courts, but what are the underlying issues that have caused that. And so often the substance use is a solution to their early trauma, and they see it as the solution, not necessarily the problem.
And that's why, if we go to the next slide, you'll find in the early writings of Dr. Folletti and Dr. Anda, they quote from T.S. Eliot, "In my beginning is my end." If we really want to understand why somebody is a chronic smoker that has health problems, why somebody is in the court system, the criminal justice system, in the prison pipeline, why they are substance abusing, then let's look back at the beginning. And if we could go to the next. Oh, and I do want to point out that we have a habit of saying, and particularly, as a society, is that time heals all. Time doesn't heal, it simply conceals. And sadly, what we're looking at is somebody else's solution. If you look at the top 10 leading causes of early death, as the ACEs study did, and established the link between adversity as a child and risk-taking behaviors, neurodevelopment interruptions, what somebody is doing is, if they want immediate relief, they're turning to pharmaceutical devices, drugs, alcohol, because it's a coping device for them to deal with the stress of abuse, domestic violence, and family or household dysfunction. Anger, anxiety, depression. Methamphetamine used to be prescribed for depression. And I know in my court, if somebody is slipping because dealing with a substance use disorder is not a straightforward step. There are steps back, and they're using meth. It tells me we have to continue to find the right therapy that's trauma-informed to deal with whatever is depressing them. And I think it's important to understand that when Dr. Folletti was talking about protected by shame, secrecy, and social taboos against exploring certain realms of human experience, number one, we do know that sex offenses occur widely in our society. The standard and the most recent are, 1 in 4 girls, 1 in 6 boys. Nobody talks about it for all sorts of reasons, both because the offender has told them horrible things will happen to them or they have been shamed. It's their secret. They don't talk about it. But what's worse is the medical society developed protocols going back in 1998 at every step in the medical field. They were to ask questions of their patients about domestic violence, which they have begun to do and have done more so. But they also shortly thereafter developed protocols to ask questions about sexual experiences and abuse. They have failed to do that. So it is, and by the way, when Dr. Folletti proposed this question on the questionnaire, the doctors that were going to do it were appalled, saying, well, what if they were a victim? What do I say? And his answer, which I have found to be so true, is to just listen. And it lifts the veil of secrecy. There is no more shame. And they noted to him that the doctor didn't feel any differently about them when they told this horrible, shameful secret. So that's why we have to go deeper. We have to have the ACE survey. We have to follow, because otherwise we're just going to keep treating what the apparent problem is. And as Dr. Daniel Sumrock from Tennessee, he was one of the very first doctors who has ever been certified as an addiction, a medicine specialist. He's terrific. He doesn't use meds for antidepressants. What he does is he's trying to work in group with them. He treats them with respect. He gives them quality care. He wants them to find a different ritualized comfort-seeking activity. Go coach your kids' soccer. Go to the gym for 30 minutes. Go walk for 30 minutes. Find something else to replace it. And they also discover that because he respects them, because he cares, because he deals with their slips in a positive way, they finally discover that they go, you don't hate me for what I did? You don't disrespect me? And they keep moving forward, and people are holding down jobs or reunifying in his groups that he does in Tennessee with their families. The reality is that respect makes all the difference in the world. And this applies whether you're the doctor or you're a clinician, you're a therapist, you're the probation officer, whoever you are, the judge. we can make it we can make it possible for people to heal if we integrate ACEs. He also does use prescription drugs, and I know that's always an issue, but he tries to work with Suboxone and naltrexone, whether they have a drug or an alcohol program, but it's been highly successful in Tennessee, and we could apply that across the board. Dr. Graham?
Yes, so we're sorry that this WebEx platform does not have the capacity to play video clips, but perhaps you all saw the 60-minute special recently where Oprah had Dr. Bruce Perry on, and she talked about her own abuse and teenage pregnancy, and she's like, what's the difference? Why do some people, make it and other people don't? And he says it's very simple. It's about relationships, and that everybody that makes it had somebody in their life that gave them a hand up and was the nurturing person in their life. So I think we talk so much about ACEs and adversity, and we need to talk a lot more about what are the solutions that help families with drug addictions become more resilient.
And we can't be, I just want to say we can't be part of the shaming. I find often among professionals that they'll say, well, hey, I had some of those bad things happen to me and I turned out okay. What's wrong with them? Or the term of, pull yourself up by your own bootstraps. Dr. Perry in that interview says, well, sometimes somebody had somebody helping them pull up their bootstraps, that nurturing relationship. I had the ACE survey done when we had Dr. Folletti come last summer to the our circuit judges conference in Florida. Our judges were higher in many of the categories of ACEs, but they also had outstandingly high scores in resiliency. That is, they had buffering relationships. Amy?
So Dr. Perry also says if you provide the same experience for the same period, you won't get nearly the same impact if you intervene at age 10 as if you intervened at age 2. And we know that's because, at age 10, the brain is much more hardwired, that in those early formative first 5 years of life are when the brain has the most plasticity to change and to grow. And so the best chance to turn things around is in that first 1,000 days from conception to age 3. And we are delighted to have so many initiatives around the country and internationally about the first 1,000 days. A couple of years ago, I went to the World Infant Mental Health meeting in the UK, and they were talking about the first 1,000 days initiative to eliminate poverty and child abuse. And it's like, we don't even talk about those things in the U.S. And so we came home and said, boy, we got to up our game here. And so in Florida, we have a first 1,000 days initiative. Then it's really been an umbrella that's brought all of our agencies together, hospitals and early intervention and home visiting and child care and early care and education and child welfare, all under one big tent to say, what can we all do to have a more collective impact by working together. I've just been in Sarasota, Florida, and thanks to the Barancik Foundation, they've started the first 1,000 Days initiative in their whole community and are really bringing everybody together for a much more collective impact about that time from conception to age 3. So that is also one of the reasons that brings us to our early childhood court. We really wanted to create a whole state. When we first started talking to our judges and our Supreme Court about trauma, one of the Supreme Court justices said, well, why do we just have to have trauma in our baby court? Why can't we have trauma-informed all courts? And then the schools said, well, why can't we have trauma-informed schools? So we've really been looking at how do we create a trauma-informed state. Tarpon Springs was the first trauma-informed community. If you haven't been there, it's a lovely little town near Tampa area, because when we look at the larger adversity at ACEs, we're really looking at community violence and as well as community solutions. So we really want our communities to come together to be a resource for healing. I know that Seattle and our colleagues in Washington State have done so much about eliminating homelessness in Seattle by ensuring that every person had at least one or two support systems, and they reduced ER visits and homelessness by simply connecting folks to have that strong support system across their community.
And that SAMHSA spotlight that's listed below can give you some steps that you can take to transform your community. And also that book, that picture on the prior slide that Dr. Graham had, is available on Dr. Graham's site. She's going to come to that, and you can find what we have begun to gather in Florida. But you can also, and there, Tarpon Springs is outlined, but there are solutions and methods to follow to transform your community.
So we did, Judge Tepper invited Dr. Folletti to speak to our judges conference. I think there were over 700 judges, and it was quite impactful. And we also invited folks from all over the state. We had a sheriff that drove 10 hours each way from Pensacola to Naples to be there. We had school superintendents and public health and all our different systems together to really hear him talk about how this is not just a juvenile court judge's problem, it's not just a social worker's problem, it's not just a pediatrician's problem, it really is all of our problem and the most important opportunity to really change the trajectory. So what we're trying to bring to the courts is to put on a different pair of glasses. We like to talk about Salvador Dali. There's a museum in St. Pete, and in his paintings, he was able to see, you look at it with one lens and you see a naked woman, you look at it another lens, you see Abraham Lincoln. So he had this uncanny ability with a lens of his camera to show two totally different views of the same painting. And that's what we're trying to do, is bring a different lens to how the courts view families and not judge the story by the chapter that we happen to walk in on. For many of our families, we're seeing them on their worst days, not their life in total. So helping the courts to see the families with a trauma lens, and then to see them across all of our systems, so that we're not expelling kindergartners or Baker acting them, or we're not missing these kids and misdiagnosing them as ADHD when it's trauma. And all of our systems bringing a trauma lens. We love all the good work from the National Child Traumatic Stress Network, which defines the trauma-informed child and family service systems. And we've been working with our systems to build trauma-informed programs, really using the science and helping support the whole family's capacity to thrive.
And I do want to point out on the in terms of resources, you know, I don't know what each of your backgrounds are, but the National Child Traumatic Stress Network, they pretty much have something for everybody. They have something if you're a child welfare attorney. They have something for if you are a therapist doing an assessment. They have a judge's bench card. They have vast resources that are very easy to use, and I am always sharing them with the stakeholders in the court system. I urge you to sign on and use their tools readily. In addition, the National Council of Juvenile Family Court Judges, which has partnered with National Child Traumatic Stress Network in creating 2 bench cards, they also have a wealth of information. The irony is they came up with questions every judge and lawyer should ask about infants and toddlers in the child welfare system, going back more than 15 years. I only wish that it was being done around the country because it's exactly what the Early Childhood Court is doing. Mimi?
So as part of Dr. Folletti's visit to Florida, we put together this booklet to really showcase some of our trauma-informed initiatives across the state. We showcase 50 different programs, from courts to trauma-informed hospitals to trauma-informed sheriff's office, schools, just really across all different systems. And it's downloadable at floridatrauma.org, and it showcases several of our early childhood courts. If you want to see the pictures, this one you see Judge Tepper with her dog therapy there and in court. And so we also know that early childhood court can change the tragedy that brings families into the courtroom into an opportunity to heal. And as we just talked about, therapeutic jurisprudence really seeks to look at both the case and the problem that produced it. So officially, we're called Florida's Early Childhood Court. We fondly call it Baby Court, but it is one of our many problem-solving courts like Drug Court, Veterans Court, Mental Health Court, Girls Court, where we intersect the legal, the societal, and the individual problems. So really, in a nutshell, what Baby Court does is it heals the multi-generational trauma by bringing the science of child development into the decision-making for young children who've been removed from their homes. And we are so indebted to 0 to 3 and the Safe Baby Court teams, which were the first baby court teams. They have done some impressive evaluations, and of their national model, they found that almost all the kids, 99%, were protected from further maltreatment. They were not re-abused, did not come back into the system. They received services that met their identified needs, and that they achieved permanency within 12 months. So it was quite an inspiration for.
And you saw that the cover of a video that they do, the Safe Babies Court. I urge you to track that down and watch it. You'll see there's some video of Jean, a mother of a child who hadn't bonded adequately with her child, didn't know how to read her child's cues, and you learn that she was a child who had been abused and had grown up in the foster care system. All of the videos that they have on there are very helpful to use to educate your stakeholders and for you as well.
And they're available just from Googling 0 to 3. So a couple of years ago, 0 to 3 got a national grant to be a quality improvement center for what they call infant toddler court teams and demonstration sites. And there were New Haven, Connecticut, Florida had 5 sites, Hawaii, Iowa, Hattiesburg, Mississippi, and the Cherokee Indians in North Carolina. And they looked at ACE scores in those court teams and found an amazing that 63% of the parents had 4 or more. And you can see the high percentage by the chart. And at least 70% of the children had at least one parent with 4 or more ACEs. And so they have done a lot of work about, how do we know that the Safe Baby Court teams work? It is on the California Clearinghouse as an evidence-based intervention for child welfare. They found that almost 84% reached permanency within 12 months. And of those, almost half, or 48.6%, were reunified with their parents, 32% were adopted, 14 with a relative. So they were delighted, and almost 75%, that was the lowest percentage among sites for reaching permanency with the 12 months. We know that most of our states, our kids languish in the system for much longer than the 12 months that is nationally mandated. So here's Florida. We bring you some palm trees. It was 106 degrees last week in Tallahassee. So this is why half of Florida goes to North Carolina in the summer or other places. But we started with 2 pilots. Judge Tepper there in like the Tampa area, which is called Dade City, and Pensacola, which is almost to the Alabama border there. So we had 2 pilots. They were so incredibly successful that lots of other judges wanted to start them as well. And so the slide on the right, the map on the right shows 22 sites. We are delighted to add a 23rd one, that Naples, Florida is coming online. We have a conference next week of all of our 23 sites, and their teams will be coming to Orlando next week. So it's been pretty amazing how we have grown. We've also done it with no dedicated money. Medicaid has been an incredible partner because they pay for the therapeutic part, and all the rest has been cobbled together.
And the judges know they can email, or we have another device called Yammer, or even pick up the phone and say, I've got this problem with this family. What would you do? And it's allowing us to put all of our heads together and all of our experiences for the best interest of children.
So what is early childhood court? So in essence, we really have the ACEs science. And thank goodness to Dr. Nadine Burke-Harris. Her TED Talk has been so inspirational, as well as her book, and we're so delighted. She's the new Surgeon General in California. We wish we too could clone her, but we really brought the science into the courtrooms and to educate the judges and the communities. We brought the early childhood systems, the early childhood, the early education, that these kids are placed in high quality child care. The home visiting and the McVie home visiting network connected them with their kids in the court. The Florida Pediatric Society is a key player in our early childhood court. And then we brought trauma treatment to the courts. And in essence, that's what makes our early childhood court teams. There's Judge Tepper up there on the right on the bench. So what is it? We like to call it a 3-legged stool, or really 3 key components, although there are others. But the first is really having a trauma-informed judge. And then a community coordinator who fast-tracks services, and then the child-parent therapy that's really addressing both the parent and the child's needs. And together, this combination of services accelerates permanency, reduces reabuse, and enhances well-being. So what does that look like? Well, first you have trauma-informed judges who are educated in the science. Judge Tepper, you want to talk?
Yes, and we've been, fortunately, the education in Florida, the judges' plan, they've been very open for us to continue to teach judges their individuals that appear before them with a trauma-informed lens. And we have been building a very strong base of experienced judges now, and people are amazed when we'll go and do it. We teach a delinquency program and teach them how to be trauma informed. Judges that have been doing this for years, but maybe hadn't been in delinquency or hadn't been in child abuse court, are going, oh my God, of course this makes so much sense. And it is truly like suddenly seeing through a trauma lens. It all comes into focus, and it's very enriching because then other judges in their jurisdictions might look to them for education, and they, like me, have built stakeholders where as much as 9 times a year, we might put on education for our community that works with children and toddlers so that they can do it in our area as a result of being a trauma-informed judge and then bringing it to our stakeholders. We have our Early Learning Coalition has done Train the Trainer on some of the very practices that we are teaching our parents through our infant mental health specialists to use in working with the children that are coming into the daycare, so they're not expelling them, so they are meeting their needs and helping the children learn how to self-regulate. It's been extraordinarily well accepted. We just have to do more.
One of the pieces of research that really resounded with the judges was the still face experiment that many of you are probably familiar with, where you have a parent and a child and you ask the parent to just have a blank face, and you see how dysregulated the baby gets and how and then they really kind of lose it just in these 2 minutes, where the parent is not in serve and return and is basically ignoring the child. And then you have them re-engage as they normally would, and the baby gets back to normal really quickly. And we talk about how many of our families, particularly our families that are drug involved, how many of them are emotionally unavailable to their children. And watching them for that 2 minutes just get so dysregulated was really powerful in talking to judges about why visitation is important, why, helping to repair the relationship and the serve and return interaction, and that made a big difference.
And we had the Florida Courts website that you see in the upper right-hand corner. That's constantly changing. If you go to the FLCourts.org, and then under publications, you'll pull down toolkits. And we have a number of toolkits, but this one is the Family Court Toolkit on Trauma and Child Development. Again, it's always changing. And then, as you'll notice, it has the problem, and if you pull that up, it has interactive information, and then it has the solution. It's interactive in terms of how you should be speaking to people, enabled, and it also has the ability to pull up where a child should be in terms of their milestones from 0 to 18 years. It has the court implications, how we can impact it. It has resources. It has the best and the brightest, and it's always being added to. It has Harvard Developing Child. It has Dr. Folletti's articles. It can link you to Dr. Ed Tronick's still face video. And it also even has, under the trauma curriculum, they've been adding so that attorneys who always understand trauma can take and get continuing legal ed credits on how they should be communicating with their clients, be they the parent, be they a defendant, be they a juvenile. And by the way, that and it has the entire website is interactive. Click on it, it'll take you somewhere else. And below that, you can see one of the bench cards that I had referenced that the National Council of Juvenile and Family Court Judges had joined with the National Children's Traumatic Stress Network. But as you can see, we're trying to educate judges using science. And so when we have to make a decision of, well, in Florida, I only have to visit once a month, I go, well, wait a minute, I've got here, the science tells me that the more frequent the contact, the more likely they are to bond. I'd better allow daily visitation if we can do that. And then, of course, the part that is often missed that is so critical that belongs in every division, but particularly with young children, and in a few minutes you'll hear a little bit more about our child parent psychotherapists, is trauma screenings. Every child, every parent needs to be screened for trauma. And we need to, again, have stakeholders together so that we can be educating them, so that the early childhood, the schools, the parents, the substance abuse providers, mental health care providers understand that trauma is the key.
And
if we go to the Yeah.
To say that Judge Tepper, she asked them in court, when this really began, it's like, well, where is the trauma treatment in our community, and what credentials do you have? It's just amazing to me that we have providers in our child welfare and our delinquency that are not trauma trained, because all these children have trauma. If they didn't have trauma before they came to the system, they certainly have trauma when they leave. And so making sure
and it is
that all
astounding.
So Judge Tepper says, show me on your resume,
Yeah.
that you had.
And because if I ask somebody to do a trauma assessment and they call my office and go, well, she'll tell me what it is, I'll be happy to do it. And I'm like, well, then tell them not to do it. But we've been building capacity, as can you. But this is so simple. It doesn't take money. It doesn't take training. It is literally for each of us that are touching the life of a parent or a child involved in the system, flipping the script. Have eye contact. It's that simple. It's a form of showing respect. Don't be reading a court file. Don't be reading the medical record that you should have read before they came in. You're going to read all of the information in advance, and you're going to treat with them with respect and kindness. After I retired from 34 years and I gathered all my papers and I'd saved the notes I'd received from people, and I started rereading them, what ran through all of the notes were, you were kind to me. You treated me with respect. You believed in me. And that matters. And these are people that were able to overcome their trauma, even though I didn't know anything about trauma in 1985. And then, of course, when we talk about regular feedback and reflecting, somebody's going to come to court, and it might be the parent of this newborn or this 6-month-old, and they're obviously distressed. If you're really paying attention, or they come into your office or into a group, and you look and they appear to be troubled, all you have to do is take a moment and say, I can see that you're confused, you're having a bad day. Do you want to talk about it? Or when they're trying to say something, but they're not getting it out, and that's when you turn it around, well, it sounds like you're saying, and you're acknowledging that they're having a difficult time, and you're giving them permission to not be okay and to seek ways to be okay. And obviously, it's important that you know the people you're dealing with. Remember them. I have a good memory, but I also make sure that I'm staying up on who's coming before me on a given day so that I can remember what was difficult for them in their life, or that they just had a parent die that is adding to their stress and their inability perhaps to be on track as we would like. And of course, as Dr. Folletti said, just listen and don't judge them. Be encouraging.
So the second part of the three-legged stool, if you say, is the community coordinator and a collaborative court team. So this team meets monthly and has monthly court hearings, as opposed to what's regular is every 6 months. So it's able to figure out what's wrong and to quickly solve the problem. So, for example, when children are removed, the parents lose their Medicaid. So one of her moms was depressed. She lost her depression meds because the children were removed. Well, if we're ever going to reunite this family, we need to make sure the mom has her medication. So we were able to quickly get her meds back because we knew that. Or their car broke down and they don't have a way to do visits, and so you get them bus passes. Whatever the obstacle, you're dealing with it fast, and so you can really, the parents either making progress or they're not making progress. Either way, you can tell from the beginning.
What's key is it is every 30 days, and it is precedes whether it's a week or a day or half a day before they come to court, because they're coming to court every 30 days. But it's not to find out what the parent did wrong. It's to find out what happened to them or what's going on in their life so we can help them successfully overcome their trauma and ideally reunify safely. So
this is the example of the Fort Lauderdale team. And so you really have all your team together, your foster parents, domestic violence, early intervention, child care, early Head Start, guardian ad litem, attorneys, substance abuse, home visiting, local universities, hospitals, child welfare, and everybody's really working together. So I know I sat in Judge Tepper's courtroom, and she had the domestic violence folks there from the shelter, or she had the substance abuse treatment provider. So if a family came in, she could just have them right there say, okay, we'll start it today. And there was really fast tracking, expediting whatever the families needed. And then the third part of the three-legged stool is really the therapeutic part. And the child-parent psychotherapy, which is a fancy word for saying that we're looking at the parent and what were their built in the nurseries, or what was their trauma and the child's trauma, and then working on the relationship, whether to repair or maintain or strengthen the relationship. And this is an evidence-based treatment under the California Clearinghouse for kids 0 to 5 with trauma, developed by Alicia Lieberman and her colleagues out in California. And this infant mental health child-parent psychotherapist plays a prominent role in the court by advising the team about when they're ready for reunification. Are they making their therapy appointments? Are they making progress, or are they not? We also have concurrent planning from the beginning, so we don't wait until the kid is, till 12 months have gone by and then the mom relapsed, or, there's some reason that she's not going to get custody. From the get-go, we say, okay, we're going to give you every tool in our toolbox. We're going to do everything we can to help you. And we really want you to get your kids back. But if you can't, we're not going to not sleep at night, because we're going to have a plan B for if you don't get your act together, because children can't wait, and we are under this 12-month federal mandate. So,
and
excuse me.
I was just going to add that the infant mental health specialist will work with whether it's a relative caregiver, a non-relative caregiver, a foster parent that's caring for the child, so that they understand issues and the behaviors. They will even go into if they're in an early learning center, a daycare center, so that we can track what the trigger is or how they're responding. And in addition, we will have them in court. We usually have the baby in court, and the parent and the psychotherapist, and we're all having a conversation. And I may ask, well, tell me tell me about what you've gotten out of your child-parent psychotherapy. And a parent will start to just discuss meaningfully what they have gotten, and say, if they had older children, I wish I had known this with my older children. And it's really amazing to have them show what they have learned and how they're handling their child and how they can articulate it.
And I know we're fastly running out of time, so I'll hurry through these rest. So our Florida Association of Infant Mental Health has really helped build capacity, as well as FSU. We've also worked with our legislature to make sure that therapy was Medicaid funded, and that's been huge for us. We also know that children's ACEs are linked to challenging behavior. We also know that the parents' ACEs are linked to children's challenging behavior as well. We also know that many kids in child welfare have developmental problems because most of the kids coming in have been neglected. 75% of kids come in for neglect, and so they have these problems not because they're not smart or capable, but primarily because they haven't had serve and return. They haven't had enriched environments and enriched relationships. I love my trajectory slide. The green arch is healthy kids, the yellow at risk, the red is a delayed trajectory. So we know what factors, what adversity pushes kids down from healthy to at risk or delayed. But fortunately, we also know what are the protective factors, what are the interventions that can push kids up from being delayed or at risk to a healthy trajectory. And those are nurturing attachments, quality environments, targeted supports, and then intensive interventions. And in Baby Court, we do all of those. This is just a different way to look at it. It's called the pyramid from the Center for Social Emotional Foundations for Early Learning. 80% of kids are going to do fine if they have nurturing relationships and high quality environments. About 15% of kids are going to need some kind of targeted supports like a consultant to their child care or a home visitor or some support. Only about 5% of kids are going to need the intensive child-parent therapy, but those are the kids who didn't get everything below on the pyramid. They didn't get the relationships and the high-quality environment and the serve and return interaction. So what we know the secret ingredient is relationships. It's relationships at every level. It's the kindness of the judge to the family, as you've heard from Judge Tepper. It is the community coordinator working with a parent to help them with what housing and drug rehab and whatever their concrete needs are. And then it's also the parent's relationship with the child. And that's what the infant mental health therapist works to promote. So we know that our early childhood courts really foster relationships, and that's what buffers the adversity. The difference between toxic and tolerable stress is having a supportive relationship that is there to buffer that stress. So this is our data from the last 4 years, from 2014 to 2018, that our kids in early childhood court are getting to permanency. Now, to permanency means either they're reunited with a family or they are adopted or permanent guardianship, but they're getting to permanency about 4 months faster than the statewide average. You don't have to do very much math to realize how much money that saves just in out-of-home care and how less traumatized they're going to be by having a permanent family earlier. The chart on the right shows the different amount of days, and you can see in reunification, our families in early childhood court were reunified almost 8 months faster than the regular. But more importantly, when you heal the underlying trauma that brings the families into the court, then they don't come back. Either they are no longer depressed, or they're no longer doing drugs, or whatever was preventing them from keeping their child safe. And so we have about a 40%, Florida's rate of reabuse is 10%, and early childhood court it was 6%, and so we're doing much better than the statewide average. If we had video capability, we would show you reunification. You can see it on our website. So we have increased the number of kids each year we've served, but still we're only serving less than 3% of the 12,000 kids ages 0 to 3 in our state, and we're serving a higher percentage, I think, than any other state, and still is just a drop in the bucket. We won an award for potential savings for taxpayers. If you want to see, we have some really cute videos online. This is our website. In addition to
they're not just cute. They're really profound, and I urge you to look at the longest of them. And one of the things you will see is now retired Supreme Court Justice Periante speaking about that by the time she gets them, when they're there for a review of a death penalty case, it's too late. And we need to be intervening. And I can tell you that in every single murder case that I had in which we did a death penalty, no matter how heinous the crime, every single defendant had horrendous adverse childhood experiences. So we can get them before they end up being sentenced to the death penalty.
So it's an 8-minute video. It really that explains the whole thing. There's the web address to see it. We love this. That's an old photo. The butterfly is sitting, the caterpillar.
Hearkening to Maya Angelou, that we delight in the butterfly but rarely admit the changes it has gone through to achieve that beauty.
Right, but we really have witnessed that early childhood court is transformational, and it brings families hope. It changes their trajectory, and we're so grateful to have this opportunity to talk about early childhood court. We invite you to come visit any of our 23 sites. You might want to come in the middle of winter when it's snowing in other places. We've also made a list of resources and urge you to read. These are some of our favorite books that we put together. So I guess now we would love to take any kind of questions that you have. I can. Is there CEUs for this webinar? I don't know. Susan, do you want me to move to you?
Here yes, I believe Susan or Carla were going to help us with the questions.
I'm moving it. Yeah.
I believe, it's Susan back. Wow, what an incredible presentation. Can everyone hear me, I hope? I've got somebody cutting in on my landline, so I apologize for that. There were very few questions, but I want to encourage people to if you have a question, to put in your questions in the chat box. We did get a question from Randy about, did the bill to have baby courts in all circuits pass?
No. It did not. Last year, a bill passed, and the governor vetoed it. This year, it didn't even make it out of committee. There was a lot of other things going on. So we're really hopeful this year to get our legislators to go and visit the baby court so that they can better understand. One of the complaints was that it wasn't cost effective. And what that showed us was that they had no understanding what it was, because it is, when you stop the cycle, not only does it save, for those families reunited, 8 months of out-of-home care, it stops the cycle and saves so much down the road. So we just need to do a lot more education. Our legislators really don't understand what it is.
But hopefully this coming legislative session, things will fall into place. Our new Chief Justice seems to embrace early childhood court. I know the incoming Senate President would like to change the world for child welfare and has some understanding and has been in my court. So things may change.
And we do have a few questions now that I want to clear up. Somebody was asking about CEOs. Unfortunately, we don't provide those, but you will get a certificate. All right, so one of our participants would like to volunteer somewhere as an interpreter, so maybe you can get in touch with Dr. Graham or Judge Tepper about that. And then we got a question from Donna. Who funds the court administrator? Did the early childhood court begin without funds? And yes, the PowerPoint will be sent out within a week with access to the recording. So to Donna's question, can one of you answer that? Who funds the court administrator?
This is Judge Tepper. Let me try. Obviously, court administration has general funding with the courts, although they have had it cut back significantly. But because there are various federal funding sources available, and Mimi knows some of those, we have ones that are specialized that most of the people in the court system, and I think one of them who is funded is watching this, Lee Merritt, they are funded through Office of Court Improvement. That was because of all the problems we'd had over the years with ASCA to improve our systems. But locally, the court coordinator, that community coordinator that we mentioned, we have failed to get that funded statewide, so every jurisdiction solves it on its own. I fortunately had a positive relationship with a community behavioral health program I'd worked with for 35 years, and they agreed to fund her. But it depends from community to community. You just have to be creative.
So some of the courts, they reallocated one of their positions to be a community coordinator, like the drug court coordinator. In other communities, they're like the United Way or a community agency would fund that position. Some of it was the child welfare. So it really depended on the community. But our bill had asked that we pay for the community coordinator for all 23 sites, and that's what did not get funded.
I was looking at some of the questions on being frustrated when an attorney will come in, stay 30 minutes, hey, I don't need to know this, we're already doing this. Sometimes it's very hard to convince individuals. So it's something we'll work with local people. You know, you can't be a prophet in your own land. I have been to Oklahoma and spoken to the Judges Association out there a few years ago, and sometimes you need to bring people in from out of the area. And sometimes it isn't just a judge. Sometimes it may be a parent or a child who's now an adult that went through it, to speak and educate them and talk to the attorneys to persuade them and show some of the videos. That is some of the ideas to overcome the stubbornness or the lack of willingness to learn.
And there are a couple of that was really helpful, Judge Tepper. There are a couple of other questions that have come in that either of you may want to respond to. So one had to do with how do you prepare, the court team to go forward. Jocelyn wanted to know, is it one at a time? Do you have a statewide training? So maybe you could talk a little bit about what preparation goes into having an early childhood court team.
Me? Dr. Graham?
Either of you.
Our Office of Court Improvement really spent the training dollars for that. And at the beginning, we're having our 5th birthday next week of our Early Childhood Court Initiative in Florida, and we started with a big meeting and went through all the components and did a lot of training there. 0 to 3 provided a lot of training opportunities. The Office of Court Improvement paid for judges to go to 0 to 3 and to learn a lot, and so it was really a combination. So a lot of them started at the beginning together, and then if they wanted more training, there was a cadre of people that would go and train, and then as new ones have come online, they're able to ask the Office of Court Improvement for, support in getting that. So it hasn't been, there's not like a magic bullet. There's a lot of different ways in which you can get training now and ongoing.
Susan, I see some questions that I could answer that I
right.
have specific answers
go for it. Yes.
There was a question, I believe it was from Jessica, as very similar as to Carolyn McAllister. In terms of the best way to approach and discuss ACEs, I would urge you, if you go back to the slide that has Dr. Sumrock, and it links to Jane Stevens' interview from a couple of years ago with Dr. Sumrock, it actually, he talks about how he goes about addressing this and explaining to them. And it is to talk to them about what ACEs are. I even explain it from the bench for parties. And then they feel like, oh, wow, that happened to me, and they didn't know. They'll say, wow, you mean I'm not crazy? And it is so uplifting just to learn that. But read that article, read some of the other links. And I have discovered, I used to be very nervous about triggering somebody until Dr. Folletti said, no, this is good. You are lifting those veils of secrecy. And people will blurt out in my court, I was raped. And, first time in 60 years to say it. And so if you look at the resources, you'll get some good ideas. As to stakeholders, again, some of the slides show stakeholders, but for instance, don't forget foster parents, don't forget Early Learning Coalition, the therapist ideally that deal with substance abuse, mental health, as well as for infant mental health specialists. You need to have the attorneys on board, the child welfare attorneys. I include our legal aid attorneys. I include our prosecutors, our child welfare attorneys. Case managers are critical. Our case managers have individuals who supervise visits. We include them. CASAs are known in most of the country, or guardian ad litems. Our clerk's office even participates. Those are among the providers. And Mimi, did you have any more of the stakeholders you wanted to emphasize?
No, I wanted to go back to the ACE study and using it, and I think Nadine Burke-Harris talks about how she uses it in her pediatric practice, and she has folks fill it out, not to tell her what it was, but just to look at the score, and so then she's able to work with that. We work with teen moms that are court involved, and what we find is that you really need to work with them about 6 months before you even bring it up, because people are not going to usually reveal their traumas until they have a relationship. And so at that point, we've learned a lot about what's happened, and we give them an iPad and have them fill it out themselves. We never use the ACEs questionnaire without also using the resiliency, because what we don't want people to do is feel hopeless about what happened, but rather look at the strength. We also, our infant mental health therapists who are, expert clinicians, they talk about trauma within that clinical relationship. What we don't want to do is open up those old wounds, or do a check off, oh, so you are raped. Well, next, as opposed to having a person who has training in how you deal with it. And then Dr. Folletti talks about how the therapeutic value in asking and listening. And he says asking and listening is a profound way of doing. And so one of our colleagues has a way of asking, Linda Gilkerson from Chicago, and her colleagues there, they just ask simply, is there anything that's been scary that's happened to you or your family that you would like us to know? And so, I think there's lots of different ways, and the way you ask it is just as important as what you're asking, and to do
and how you respond when they answer. That's one of the keys is that Dr. Folletti and Dr. Sumrock found is because they didn't say, oh, my God, that they were just accepted. And Dr. Folletti will then see the results of what they filled out before they came and say, I see such and such happen to you. How is that affecting you today? How is that affecting you in your life today? So you can gain from all of those. And by the way, if you go to the Florida courts toolkits on the trauma, you'll find a link to watch Dr. Folletti's presentation during the think tank that Dr. Graham put together. It has all of his slides as well as his audio, which might be invaluable to many of you.
I'd also like to say that, we don't any family that comes into child welfare with a child under 3 is eligible. We don't cherry pick, the most successful families. And I think it was Judge Bristol from Fort Lauderdale. Her first case was a mom who had lost 6 other kids, had terminated because of her substance abuse. And once they finally started treating her trauma, she got clean and sober and was able to be reunited with her baby. And so I remember Judge Bristol saying, I'm a believer, and so I think we've seen a lot of successes. About 2/3 of the families, can be reunited. For some, it's just too little too late. But we believe this is really one of the most optimistic, transformative approaches that child welfare has available right now.
And sometimes when it does come to the point where the trauma is so deep and they have so much work to do, and we have a child who is 11, 12, and even 14 months old, and of course we're supposed to be sensitive to the 12-month mark. When I have found that, number one, I don't go to trial anymore. Nobody is fighting because they all want to be part of the solution, and the team, including the parents and their attorneys, that they will then say, you know what, I can see that my child is doing better. I have too much to do, and they will voluntarily sign a surrender. Positives of that are that the timeline doesn't get interrupted by appeals and trials and things like that, but we make them feel that they have been a loving and caring parent, and to the extent that they could still be involved in a child's life, and I've even had them involved in foster parent adoptions, it makes a difference as to whether I'm going to see them, as I used to, back on their 8th and their 9th child. That has been immense.
Thank you so much to both of you. This is Susan. With that, we are just about out of time, and I wanted to say that I think this has been a really inspiring, rich presentation from the way you've shared your experiences, your enthusiasm for the model, and all the wonderful resources that you have given us. So many thanks to both of you for the presentation, and I'd like to thank Carla Alegria on our staff for making the webinar run so smoothly. But last but not least, thanks to all of you for having joined us and spent your time with us today. Within the week, you will receive a follow-up email with a link to the recording. And in addition, you'll get the slides, and so you'll probably be able to look at some of those wonderful videos that both Dr. Graham and Judge Tepper referred to. And you'll also receive a certificate of attendance for today. At the end of the webinar, which is coming up, you'll be taken to a very brief evaluation. If you could please take a moment to let us know what was useful and what could have been better, it will be greatly appreciated. Thanks again to all of you for attending and to our wonderful presenters today, and we hope you have a wonderful rest of your day. Thanks so much.
Thanks for hosting us.
Thanks so
Our
much.
pleasure. Carla, I'm turning it over to you.